Thank you very much. And before starting, I would like to thank Torkel Snellingen, a nice infectious disease colleague. And he has an advantage. He speaks good French because he made part of his medical education in France. So thank you, Torkel, and all the people around you who organized this beautiful meeting. And also, I'm happy to follow a psychiatric guy because as I'm considered now, I'm a foolish guy. I need a good psychiatrist. But I know you're just psychiatrist for children, but I kept my child vision of the world. So, and just before starting, I would like to honor the memory of Professor Luc Montagnier. He was. He discovered the HIV virus. He was a Nobel Prize winner. And he was treated by the French authorities, the French media, as a charlatan because he was one of the first to say that these so-called vaccines were poisons. And the last time I saw him, I was with Alexandra Orion-Code, who is here, at the Luxembourg Parliament, and a few weeks later he died, and he died in silence. Silence of mainstream media, silence of the authorities. And I was at the cemetery in Paris. There were 3,000 people there to honor this man, so it was terrible to see how he was treated. So I would like to thank the small numbers of French conspiracionists and also whistleblowers, such as Alexandra. Astrid, she's not French, but she's French-speaking. Astrid Stuckelberger, she's half Norwegian, half Swiss. And there are very few people, especially professors of medicine, who spoke out. And some of them did that at the beginning, and then they were threatened, and they disappeared of the scene. So I'm proud because I spoke out in March 2020 when the pandemic started in France, and I never changed my speech. So. And so I remember when I was with Montagnier at the Parliament of Luxembourg, I said to the member of parliament there, all of you, and I spoke also to all the members of parliament in the world who voted an obligation mandate for this so-called vaccination with an experimental product. You are against all the national laws, international treaties, the Code of Nuremberg, and you'll be one day personally sued in justice for what you did. So And I would like to thank also, by speaking about Parliament, I was invited recently to give a lecture at the European Parliament in Strasbourg. I was invited. There were a handful of beautiful European deputies. They invited me to speak, and I could meet Rob Ross, this fantastic Dutch guy who conducted the official interview of one of the vice director of Pfizer, and he told her, no more blah, blah. Tell me in a few words, do you have any data that your product is effective against transmission? And the poor American woman was, she was very embarrassed. She said, no, we have no data in our file. So when we saw during 2 years, all these experts, so-called experts, politicians saying on all the TVs, we have the proof that this vaccine is very effective, 95% protection against transmission. They suspended hundreds of thousands of healthcare workers in the world because of that. I would like you to applaud all these courageous healthcare workers who rejected this experimental inoculation and who were suspended without salary. And I say also, because during the lunch, people asked me about my affair with Bill Gates. I confirm that we were 4 or 5, a handful of French friends. I sued Bill Gates in justice in France. So the tribunal audience was near Paris a few weeks ago. We are waiting for the verdict because he was invited on the French TV and said things and the opposite in different broadcasts, and we attack him for disinformation of the French population. So now, just I have to warn you, because you know Emmanuel Macron, maybe you heard about him, he's the president of the new French Banana Republic, and he with his clique consider me as a charlatan. So if you don't want to hear the talk of a charlatan, if you don't worry about it, you can stay in the room, okay? So, I can see it here, it's better. So it was a real epidemic. Now we know that the virus was handmade, but it was a fake tragedy because, in fact, if we look at mortality, it remained very low. It was a little bit higher for the first wave, but as it was said this morning, only people with high risk factors were at risk, and we knew from the beginning there were effective treatments. But every day on the TV, they said it will be a huge tragedy, that you will see cadavers in the street if you go out of your building. And as it has been said, many public health data has been manipulated because as the PCR tests were too sensitive, many cases were not cases, they were just positive tests in people without any symptom, and many deaths due to another cause were registered as COVID-19 death. And every 3 months they wanted to warn us about the new terrible variant who will kill all the planet. But in fact, as for any new RNA virus, which is new for humanity, the variants are always less and less violent. So this pandemic was not really a medical issue. It was mainly mediatic and financial. It was a pandemic of fear. And what surprised me at the first glance, it predominated in rich countries. Why? They have the best systems, the best pharmaceutical industries, the best things, and people die only in these countries. So if you look at what happened, there were the countries where big pharma was the most influenced. So since the beginning, early treatments have proven their efficacy. So most of the deaths could have been avoided. I said on the French TV, at that time I was still invited on the mainstream media. After that, the government says to all the mainstream media, don't invite anymore Perronne. He's a dangerous guy. So, but in June 2020, just after the first wave, I said on the French TV, the government is responsible for 25,000 deaths because they stopped, they forbid the prescription of hydroxychloroquine for general practitioners. And so some media said, oh, Perronne is saying foolish things, but when they attack me, they never give me scientific data. I always give scientific data, but they just say, oh, he's foolish, but they never give scientific data. And if we look at what happened, the vaccine is not needed at all. For now, I saw that in last July, the mortality in France was 0.002%. And you have to vaccinate all the inoculate all the population, including children. During the first wave in France, I think there were less than 5 children who died because they had very severe genetic disabilities. But after the successive waves, now there is no death among children and only mild cases, and they don't transmit. So we have to protect our children. So I said vaccine mandates are completely illegal because it's an experimental product. And also they couldn't have normally have even a conditional or temporary authorization of marketing if they recognize there was a single drug treatment effective. That's why they wanted to banish hydroxychloroquine, ivermectin, and so on. And for example, the former Minister of Health, Agnès Buzyn, in January 2020, before the pandemic reached France, she passed a decree to, because before, for decades, chloroquine was sold over the counter without prescription in France for decades. And from one day to another, 2 months before the virus arrived in France, it was a poisonous drug, officially for the French drug agency. So it's a pandemic of corruption, so now we agree on that. And also, it's a pandemic of simultaneous private counseling of many governments, because, as you know, the French Senate released a report recently showing that Emmanuel Macron, who is a poor guy, has no more money for nurses, but he gave more than 1 billion euros to McKinsey and 2 other counseling firms. And you see that all over the world, the governments are counseled by such firms, and you have the same decisions taken the same day in Australia, in Sweden, in Spain, in Argentina. So it's really coordinated. And what was very surprising that the outsider countries in Africa, Asia, and elsewhere, when they didn't follow all these international regulations, they had the best results in the management of the pandemic. So we have to cheer our African colleagues and Asian colleagues who resisted. So they said I was foolish, so I need a psychiatrist, but I just want to say a few words about my legitimacy to speak out, because during 15 years, I was chairman of several official communicable disease transmission, and I was one of the major counselors for many governments from right or left to the management of health crises, epidemics, vaccine policies. At that time, I was a nice guy, but it changed. So I made many public reports, recommendations for the French authorities. I was also a chairman of several working groups at the French Drug Agency. At that time, my colleagues liked me very much, and they elected me several times, the president of many commissions. I was chairman of the College of French Professors of Infectious and Tropical Disease during several years, chairman of the official Vaccination Committee in France, and I was, it was told, vice chairman of the European Technical Advisory Group of Experts on Immunization, ETAGE, at WHO. So I went many times in Copenhagen, not far from here, because the European Bureau is in Copenhagen. So you know that WHO at that time, I think it was a nice institution at that time. They said in 2001 that the French medicine was the best in the world. Thank you to WHO. They considered many criteria, but now I reassure you, it's not the same thing now. So how to destroy the best medicine in the world? In fact, it's very easy for medical practice, teaching, research. You only need to give a lot of money to good private consulting firms for audits and recipes. You cut fundings, not for everybody, of course, and you suppress the power of physicians, because in many countries, several decades ago, we said, oh, health expenses are too high. The people who are responsible for that are the physicians, because they prescribe too many things. And if we suppress part of the physicians, it will go much better. They were intellectual people in the ministries. So we see in France, I think it is the case in many countries, they are demolishing public hospitals. In France, it's terrible. I was chairman of my department in 1994. I remained chairman during 26 years. So I saw all the progression of this demolition. They suppressed progressively the power of doctors. I couldn't have any decision during the last years of my, I was chair of the department. I think the only thing I could decide about it was the color of the toilet paper in my department, but it was a great responsibility. But in fact, even you were giving advices, they didn't care about it. They said, "Oh, the doctors now go with the dog. You have not anymore right to give an advice." And I saw the omnipotence of hospital directors, administrative officers, and I could see that they could earn high bonuses for performance, but was suppression of personnel. So I was very surprised when the COVID-19 crisis arrived. I said, "Oh, they will probably give more money to hospitals." But in fact, they continue to decrease. I remember at that time, our Minister of Health, Olivier Véran, maybe it was in April 2020, he said, oh, I will double the number of intensive care unit beds in France. But in fact, he continued to decrease. And during the crisis, in France, they closed thousands of hospital beds, and they suppressed thousands and thousands of positions for healthcare workers. And it was not so funny because it was tragic, but at the first wave, France was hidden essentially in the eastern part in Alsace, close to the German border. And on the TV every night, it was, "Oh, it's terrible, the French hospital system will collapse, it's impossible." And they organized transfer of patients by helicopter to Germany, by a bullet train to Bordeaux or the other part of France. And in fact, we realized afterwards that there were empty private hospitals who had organized some intensive care units with the good personnel, the good machines to take care of the patient in Strasbourg, but they were not allowed to receive patients, just to show to the television that Strasbourg was collapsing. And the dismissal of thousands of non-vaccinated healthcare workers, maybe it's 15,000, I don't remember the number, it's terrible. So they said, well, yes, we have no more money, but this brave Emmanuel Macron gave 3 billion euro in 1.5 years to the mainstream media. 3 billion. With 3 billion, you can build several hospitals, pay nurses during years. For example, they gave money for drugs. Remdesivir. Remdesivir was not an anti-infective drug. It was invented by the nuclear industry. It was a mutagenic agent. And Didier Raoult said to a French deputy that because at the beginning he was invited as a scientific committee created by Emmanuel Macron at the Élysée Palace to manage the pandemic. At the first meeting, Macron was present, and the CEO with Gilead was present with boxes of remdesivir on the table, saying, "Here is a magical drug for the pandemic which is arriving." In fact, it was ineffective and dangerous. Okay, and the PCR test was made to be too much sensitive to amplify the number of cases and of deaths, because normally Kary Mullis, who was a Nobel Prize winner, he was a guy from California. He died, unfortunately, just before the COVID epidemic. He always said, never use PCR in people without any symptoms, because there are, even if the test is very good, you are always a small proportion of false positive tests. PCR should be used only to confirm clinical and radiological diagnosis. And also, as you know, they amplify too much because it's a little bit technical. Normally, you amplify 20, 25, a maximum 30 cycles of amplification. And for the COVID, they amplified 40, 45 cycles. So you can amplify nothing, just a little bit of RNA fragments which are not infective anymore. But they could increase the waves artificially. So today, it's not only COVID, but the medical practice, as it was said by other speakers today, is at orders. Only official recommendation counts. Even this recommendation are of bad quality, they are not evidence-based, realized by incompetent or corrupted experts, and they rely, sorry, it's a bit of corona. That's okay. Okay. Thank you. So it's very dangerous. It's a Norwegian variant. So the physician experience and the patient's feeling and agreement don't count anymore. It was said this morning that the evidence-based medicine, you have 3 points. What is published, but it's not always very good, or sometimes absent. The experience of the physicians, and also, at last, what the patient thinks and wants. But that has been put in the rubbish bin. So suppression of freedom of expression of doctors and university experts. Normally in the French constitution, it's written that professors of universities have a liberty of speech. I'm a professor, but some said I did not have this liberty, and even the equivalent of the Supreme Court in France recently said, no, now the doctors, they are not free to speak out. They are obliged to follow the official recommendations. So there was a witch hunt against resistant physicians. And today, the Sécurité Sociale, the public insurance company, they have computers, and for the physicians who prescribe too much hydroxychloroquine, ivermectin, they send their copy of their prescriptions to the order of physicians, and hundreds now are summoned to be radiated with suppression of their medical license. So I was attacked also, as you were told, but happily I won completely. It was the day after all the French-speaking countries were aware about that. I received many messages, but Mary Beth Pfeiffer, she's an American journalist, and I wrote a preface for her book on Lyme disease several years ago. She was in Paris at that time. She wanted to interview me, and she wrote an article in October. One persecuted doctor trials of a COVID repression. So that was nice. And the verdict, it was the disciplinary chamber of the regional order of physicians of the Paris area. And they said in their verdict, in view of my national and international expertise, I had not only the right to speak out to give a dissident view, but I had the obligation to do so. I think that Emmanuel Macron had a bad night this day. But so they are destroying city ambulatory medicine. Now there are less and less general practitioners. So they are in burnout because they have too overworked. They are underpaid, so the consultations are shorter and shorter to see more patients to earn a bit of money. Some promote expensive complementary exams or acts. And what is very funny, not funny, it's terrible, but our ministers say, yes, we have solutions, because they don't want to increase the number of physicians, because physicians are dangerous people. They think too much. They have to be suppressed. they created a corps of super nurses, not yet implemented in France, but it's already in the law. Now it's flourishing around France. They are installing automatic consultation machines in supermarkets and pharmacies. So you come with your social security card, your credit card, and you put all your medical data. You can connect with the physician behind the screen. He can print you a prescription. And recently, it's very recent, last month, a new law authorizing pharmacists to practice medicine. Simple at the moment, maybe that's terrible. And the other physician normally should defend the physicians, but they don't say anything. They prefer to attack the physicians who saved thousands of lives with their prescriptions. And also the invasion of computer science in medicine is terrible, because now I saw that in the public hospital. Before, all the records were handwritten. Now it's all on the computer. And normally a patient can oppose his consent to, but they're not aware of, so everything is on the databases. And in fact, if somebody knows how to access to the number of the patient who has been hospitalized, you can see all his medical history. And I know, for personal, not my personal examples, but examples of people I know, that many people who are not really authorized could see their medical records. I've heard about a professor of medicine in France. He was dean of his faculty. I think he had a cancer. He was operated for his cancer. And in his hospital, he looked on his computer, because normally you can see, if you know the way to do it, who had access to your medical record. He could see that half of the students of his faculty of medicine looked at his medical secret records. And we know now that Macron sold our medical data to, I don't remember if it's Microsoft, or to American international database centers. So they are transmitted to foreign data centers. And now, the complaint of many of my patients, where they see some specialists or GPs, they say, now when I see a doctor, he spends half of the time on his computer. He didn't listen to me. And physicians must do more and more administrative tasks. Even the faculties of medicine are under control now, and control of big pharma. I realized recently that was initiated by Rockefeller in the 20s in America, because at that time they closed some universities in the United States because they were not in favor only on chemical products, because Rockefeller just bought all the chemical industry in the US, and all medicine should be targeted toward medical products, chemical products. And it was the start of the denigration of or prohibition of many other approaches, including natural medicine, Chinese medicine, acupuncture. And, now the research, as it was said several times this morning, is under control of big pharma, because if you want to have a project finance, the public fundings are not many, only small amounts, so you're obliged to ask to private companies. It's a so-called public-private collaboration. But if your project will not favor a drug, they expect it will give a nice return on investment, you don't have the funding. I saw that several times with chronic Lyme disease. This disease doesn't exist. So if you ask, they say, oh no, Perronne is speaking about that, but he didn't publish a very nice randomized study. But I asked during decades to have randomized studies funded, but all the time they said, no, we don't fund So no place for natural medicine, phytotherapy. I use phytotherapy for more than 2 decades. It's very effective in many chronic conditions. Food habits. This morning you were told about the lobby of sugar. If you see in the entry hall of this building, it's full of sweets and sugars all around. And also, they never fund projects challenging the usual consensus. I saw in official reports written by great French microbiologists, no, it's impossible to support this project because all what they say is not already known. So that's research, only confirm what is already known. So it's nonsense. And now it was said this morning, the financial control of major medical journals with frequent frauds. And I would like to make a comparison, because before COVID, I was also in opposition with my colleagues, with my authorities, about chronic Lyme disease. It's a completely different disease. Borrelia, it's transmitted by ticks. I know that you have dangerous ticks here in the Nordic countries. But in both cases, these microorganisms were modified by man. And you could see that I'm conspirationist, but about Lyme, read the very fantastic book by Chris Newby. It was released in the beginning of June 2019, just before the pandemic. It's called Bitten by... And she revealed the archives of Willy Burgdorfer's lab, because Willy Burgdorfer, he was a German-Swiss. He worked with the American army and the former Nazis and Japanese in the United States near the city of Lyme. And he said before dying to Chris, I know that my archives will be burned by the CIA, so I have hidden my archives in a garage. Here are the address, the keys, and she, with her husband, she could digitalize many photos and scans of the documents. And 1 month later, it was the beginning of July 2019, the US Chamber of Representatives voted a motion to create an investigative committee on the Pentagon's activity. It is true that you expose the American population to bioweapons. Unfortunately, the COVID crisis arrived, and so nobody speaks anymore about this commission, but I hope it will come out later. So this is a book I recommend to you. It's just to compare, because when the COVID, as I was accustomed to the manipulation about chronic Lyme disease, when the COVID crisis arrived, I could, in my mind, make immediately the comparison. For chronic Lyme disease, it's a disease that is not authorized to exist, so denial of the disease. For COVID, everybody should have COVID. So, but in both cases, we did bad serologies, because I wrote it in my books. Serologies for so the detection of antibodies to see if you have we are infected with Borrelia. They detect only 5% of people infected, because it was, as said Willy Burgdorfer in an interview, they just decided the results before doing the studies. It was only an artificial threshold. And for COVID, as it was said, they also did bad serologies, or say, no, it's not useful to perform a serology in a person who had the disease or who had been vaccinated, because otherwise it could show that most of the people in the population had already antibodies, and even they can do sometimes a second, third episode of the disease, it will be milder and milder. They are naturally protected. And a French, not physician, but physicist, published, it's called David Mendel, published in 2020 a paper comparing and studying the serologies for COVID officially recommended by the Pasteur Institute. And he said, most of them were, he didn't say double bullshit, he wrote that in very nice scientific words, but they were not good tests at all. But I had a video conference with him at the end of 2020. I said, oh, I would like to continue to work with you on this subject. No, I don't work anymore on that. I have been threatened. He didn't continue. So now just to continue the comparison, in Lyme disease, you have guides from the CDCs. You know, like the CDC depends on the American Army. They have a military, they depend on the military system, the civil servants within the CDC. And they influence the IDSA, Infectious Disease Society of America, all the experts in the world. They write each year editorials in the New England Journal of Medicine, the Lancet, the JAMA, to say, no, PCR, you should never do PCR in Lyme disease. It's a very bad test, too much sensitive. No, so it's not authorized. And for COVID, everybody should have a PCR test, even if you are symptomatic, to increase the numbers. So in one case, the epidemic is largely underrated, and in the other case, it's largely overrated. And just to finish with this comparison, it was about treatments, and also in the best treatment in chronic Lyme disease with antibiotics and hydroxychloroquine or phytotherapy. In both cases, these treatments were prohibited. And for chronic Lyme disease patients, when they are half paralyzed or terrible cardiac problem with rheumatisms and many problems, they are sent to psychiatry. Yes. And for COVID, at least in France, before Rivotril or clonazepam was not authorized for GPs to prescribe, and then they authorized any physician to inject intravenously a little dose of Rivotril for COVID for euthanasia. So I nearly finished. Just if you're interested by the Lyme disease stories, if you read in French, you have the La Vérité sur la maladie de Lyme in French, and I published 2 years ago the English version named Infection, crypto because it's a hidden infections, published by Hammersmith. So just nearly finished, but what should have been done? If you have to manage an epidemic, you have to isolate the patients, symptomatic, use a facial mask only if you are in the room. It's not useful in the general population. And in case of hospitalization, the isolation should be short and promote early treatments because we know that they were working. And the universal lockdown on healthy people is a scientific nonsense, and Sweden showed that it was not useful. If you have to take decision, you have to rely on, because in France, in many countries, there are already national action plans. You should involve the first-line professional, general practitioners, nurses, pharmacists. They were pulled, they said, no, we don't need you, you're not competent. And the GPs were completely bypassed. And it's not time to make long evaluation of unknown or bad strategies. And you should look at what worked during previous pandemics and compare also what happened in the different countries. And in second phase, look, because we could see that, for example, in Africa, in Asia, they use a lot of hydroxychloroquine, ivermectin, they rejected the vaccines. They had fantastic results. So you should not create new committees every day, like they did in France. You should rely on people who already had the experience of managing epidemics and also the experience of routine decision in public health. Okay, because now I have not. So how to restore high quality medicine? It's very simple. You change politicians, you change politics. You exclude big pharma and consulting firms of decision institutions. You prohibit lobbies. A French MP at European Parliament said in a book that on his office in Strasbourg, he put a poster forbidden to dogs and lobbyists. Have a strict conflicts of interest policy, reinstate suspended non-vaccinated healthcare workers, increase the number of physicians, and stop the closing of hospital beds and emergency wards. You know that now in big cities in France, before, when it was a rush hour, you could wait 3 hours. Now in some big hospital, university hospitals in France, you can wait 3 or 4 days without eating. Stop reimbursing highly expensive and ineffective toxic drugs. Scientifically evaluate alternative and natural medicines, restore the liberty of prescription of physicians, restore the liberty and the independence of mass media, and create new scientific and medical journals independent of big pharma, and increase the public funding of research. So in summary, just do the opposite of what has been done for decades. So, for those who read French, my 2 first bestsellers published in France about the COVID crisis. And just recently, in November, I released my 3rd book, Les 33 questions auxquelles ils n'ont toujours pas répondu, the 33 questions to which they still never responded. So, and I finish, we should return to holistic and humanist medicine according to Hippocrates and Aristotle, the founders of medicine and of biology. So thank you very much.